In January of 2023, the administration decided to abuse the parole system, which only allows illegal aliens to enter the United States on a case-by-case basis for urgent humanitarian reasons or public benefit by allowing 30,000 Haitians, Cubans, Nicaraguans, and Venezuelans to arrive per month. Dr. Gupta, does the decision to allow 30,000 individuals from these very poor countries to enter the U.S. every month exacerbate or improve the drug crisis in the United States?
Thank you, Congressman. I will say that the levels have flattened. We need to do more. We need to create a recovery-ready nation, recovery-ready businesses, as you mentioned, and we need to have people find hope and purpose in their life. And we're taking all aspects of it. You mentioned faith. We are meeting with faith leaders across the nation very soon next month.
But I don't see it published. It's one thing to say that you're meeting with these people, but it's another thing to be acknowledged, right?
I can tell you that this is an important piece of what we're trying to do, is accomplish or bring all communities together, whether they're business, faith, treatment, public health, or public safety, law enforcement. It is important. All of us have a role to play. None of us can fix this problem by themselves.
I agree.
I recognize that.
But allowing thousands of people who do not speak English and who will have a very hard time finding a job to enter the United States will exacerbate the crisis in the United States. But that's not all. The Biden administration is bastardizing the use of federal app originally created by the Trump administration to facilitate cross-border tourism and commerce under the Trump administration, called the CBP One app. That allows illegal aliens to make an asylum appointment at a port of entry. 37,500 illegal aliens can enter the U.S. per month. According to RISE, if aliens entering through the parole and CBP One app were added to the DHS official encounters numbers, then encounters would return to historic levels of 200,000 plus per month, numbers only seen under the Biden administration. Do you believe facilitating the entry of 37,500 aliens per month, many of whom do not speak English and will have a very hard time finding a job, will exacerbate or improve the drug crisis in the United States?
Thank you, Congressman. What we're trying to do is put technology at the border to make sure that where the drugs are coming through, we're stopping every piece of that drug that we can stop.
But you're not, because I'm from Arizona, and we see hundreds and thousands of pounds of fentanyl coming across the border. So no matter how you try to intercept it, it's going to make it worse. So I got limited time. The National Drug Control Strategy published by your office says advancing racial equity is one of the 7 priorities that your office deems to be most important in fighting the drug crisis. Another is harm reduction, which means facilitating drug use for drug abusers. How is Congress supposed to take your office seriously when you espouse such positions? I don't know how any of these have anything to do with those circumstances.